Good evening and welcome to yet another episode of COVID News. Today we're going to talk about a very interesting new development. Yesterday we talked about the milestone of 500,000 dead and over 10 million infected. But today we have some good news. About a week ago, we had results from a trial done in the UK called the recovery trial. It indicated that for some patients, the use of a very well-known corticosteroid, which has been used for many years, called Dexamethasone, can help in reducing the hospital times by almost 30%, which means the normal mortality rate would take about 28 days, brings it down by about a third of that. Not to a third, by about 30%. However, as we all say, it is not a cure. So let's get it clear. So I'm going to be reading directly from WHO, which is what is Dexamethasone and does it work against COVID-19? And then I'll also shift to another page because I'm using the actual notes from the site. So question number 1. What is Dexamethasone and does it work against COVID-19? Dexamethasone is a corticosteroid used in a wide range of conditions for its anti-inflammatory and immunosuppressant effects. It was tested in hospitalized patients with COVID-19 in the UK National Clinical Trial Recovery. That's the name, Recovery Trial, and found to have benefits for critically ill patients. According to preliminary findings shared with WHO and now available as preprint, for patients on ventilators, the treatment was shown to reduce mortality by up to 1/3, that's 30%. And for patients requiring only oxygen, mortality was cut by about 1/5, which is like 20%. Now, the particulars of the trial, let's go to another site which tells you how they did it. So the particulars for the trial, what they did, and I can give you it was a randomized evaluation of COVID-19 therapy recovery, randomized controlled open label adaptive platform trial performed on 176 hospitals in the UK. Patient randomized in a ratio 2:1, that is the ratio of standard care versus intervention respectively. Platform trial compares a range of possible treatments with usual care in patients hospitalized with COVID-19, i.e. multiple arms of the same study with different groups of patients randomized to a treatment versus usual care. Preliminary results of these are the preliminary results of the results we are looking for. Dexamethasone 6 mg POV or IV for up to 10 days, or usual care alone. Now, I will put in the information here that it's a good news, because we've always had, like from the beginning, we had the mention of hydrochloroquine, and then remdesivir came into the picture, and now we have dexamethasone. Now, the good thing is that dexamethasone is not new and it's not expensive. We use it as a steroid in normal circumstances. So we are inching to a treatment plan that can be effective. But note that according to the trial, these were for critically ill patients. So if you are not ill, you're not critically ill, you may not need this. But what you need is the 4 C's, which is to cover your mouth, clean your hands, chill at home, or clear your distance. At least you should go on prevention mode rather than deal with the consequences of infection mode. So I urge you all to stay safe, be good, be clean, be far, be home. Yes, and be safe. You don't need to get it if you don't need to get it. Yeah, you don't want to survive in hospital, you better just survive in general. So take care, have a good night. I want to thank you all for the week. This is the news, the COVID news for today. Tomorrow we cover another angle of what the COVID breakthroughs have been going on for up to date. So it is COVID year to date, most likely. That would be a good title for today. And I want to thank you. In case you need any more information, all the articles that I have quoted, I will put in the links below, so that you can be able to read up and get the real information from the real sources. While it was very much advertised and informed in the whole world, most people didn't realize that it was actually a treatment for critically ill patients who either needed oxygen assistance or are on ventilators. So the fight continues. A luta continua. Good night. God bless. Take care.